the page 1, if we can see that in paragraph 2, it said that she first sought medical treatment in October 2017. And in paragraph 3, said that Dr. Kevin has found out that has made the diagnosis that she suffers secondary progressive multiple sclerosis and not attending 5 months after the treatment. However, if we see in paragraph 4, it said that in January 2019, she feel inconvenient to see Dr. Kevin. This means that Amrita has made treatment with Dr. Kevin about 1 year and 7 months. Am I answering your question?
Okay, thank you.
Much obliged. I think it will end my submission today. Much obliged, and may it please the Honorable Court.
Thank you.
May I begin my rebuttal, my lord?
Yes, please proceed.
Much obliged. My lord, there are 3 quick points that the respondent would like to rebut based on the appellant's rebuttals. Firstly, the appellant contended that the respondent is liable for the damages suffered by the appellant due to his professional negligence. Nonetheless, we argue that our client is not liable of a medical negligence since there was no sufficient causation between failure to advise and the damage suffered by the appellant. For the causation effect in the but-for test, we submit that the probability of proper treatment by our client would have resulted in the desired outcome was less than 50%. Our client's action was not a but-for reason if the harm would have happened anyway pursuant to the case of Dr. K.S. Sivanathan and the Government of Malaysia in another. Secondly, the appellant submitted that the evidence provided by Dr. Azran has confirmed that Dr. Kevin, our client, has caused remoteness of damage since he was not referring appellant or her diagnosis to the specialist. However, we argue, pursuant to the wording of Dr. Azran in the book problem paragraph 7, which stated that such as those occasions, and the answers for clarification on paragraph 7, number 3, we submit that the delay in referral is not the only reason that declined the appellant's initial chance of remission to around 25%. Hence, if our client's negligence is considered as one of the causes of appellant's damage, it did not give rise to a presumption that he was the one who caused the damage as highlighted in the case of Wiltshire and Essex Area Health Authority. Thirdly, the appellants contended that our client, as a professional reasonable man, would foresee that delayed treatment on multiple sclerosis can cause other effects such as bladder cancer and brain damage. Nonetheless, we argue that it is impossible for our client to foresee and further give advice about the risk and damage of multiple sclerosis that will be suffered by the appellant, as the bladder cancer and brain damage are not laid down as the common symptoms of multiple sclerosis. In addition, multiple sclerosis is considered as uncommon disease among Asians as stated in the mood problem paragraph 4. And hence, we submit that the diagnosis and treatment of multiple sclerosis are usually conducted by a skilled neurologist. Thus, it is impossible for an independent medical consultant like our client to have the same level of skills and knowledge equivalent to a neurologist and to foresee the further risks and damage of multiple sclerosis. Based on the foregoing reasons, the respondents respectfully request this honorable court to adjudge and declare that the trial judge was right in law in finding the respondents not liable of medical negligence. And secondly, we submit that the delay of action made by the appellant amounting to contributory negligence, therefore, maxim res ipsa loquitur applies. This sums up the respondent's case. May it please this honorable court. Much obliged. Much obliged.
The Honorable Court is now adjourned. Participants are to exit this breakout room and enter the main room to allow the judge to fill up the score sheets in this room. Please do not exit the window or click leave meeting, and you will be invited back into this moot room once the judge has finished the scoring.